New research at the U giving us some new insight into COVID-19 deaths during the pandemic. The study confirms what many of us expected, that a person's profession could also have played a role in how likely they were to die from the disease. Fox 9's Rose Schmidt joining us from the Fox 9 newsroom with what the main takeaways from this are. Rose?
Well, Kelsey, we're talking about essential workers in Minnesota. Jobs like healthcare, K-12 education, food service, and transportation. For 2020 and 2021, researchers with the U's School of Public Health estimated what's called the excess mortality rate. It compares deaths during a crisis versus those expected under normal conditions. The study found the excess mortality was higher for essential workers than non-essential workers. And taking a deeper dive, workers in transportation, construction, and food service were more vulnerable than healthcare, education, and agriculture employees. The lead author says employers should ask what systems they have in place to keep their workers safe.
If you look at the healthcare occupations, for instance, the sector has systems or policies in place to protect their workers because they are working in situations where they might be exposed to some amount of risk.
The study also looked at Minnesota's vaccine rollout and suggested that the state did not prioritize some of the most vulnerable groups. People in food service, food processing, and retail were included in the later phases of the vaccine rollout, but they were more vulnerable to COVID than some people who got vaccinated before them. In almost all of the jobs investigated in this study, workers of color experienced higher excess mortality than white workers. Kelsey?
All right. Thank you, Rose.